Yes, Dan.
So I'll try and live up to your request. I find
I'm
the
sure you'll have no trouble doing that. We'll request for some hard questions.
I find the general approach appealing, but I have problems with some of the specifics. So let me list a number of them.
Okay.
First, you pointed out that primiparous mothers and older mothers both had higher rates of autism, but primiparous mothers have higher rates of birth defects in general. They have higher miscarriage rates also. That is, it seems that, and this is true for mammals across the board, that reproductive systems require a breaking-in period, and problems go wrong at a much higher rate with the first pregnancy than with subsequent pregnancies. So that data are basically uninformative with regard to your hypothesis. One of your predictions, for which you had some empirical support, was that mothers should wean earlier and be less interested in interacting with and investing in autistic children than not. And as you pointed out, there's at least preliminary evidence this is true. It's not at all implausible that this would be the case. My understanding from the clinical literature is mothers are often quite distressed, and they feel guilty about not bonding with their autistic infants and so on. The problem is that doesn't indicate that this is a low fitness extreme of a parentally selected fitness indicator, because the same should be true for any naturally selected trait that mothers are able to detect. So at the very end there, you suggest, well, charm may have, utility in adulthood as well. Suppose that's all there is, right? Suppose that charm is like bipedal locomotion. Right? Mothers should be less investing in children who are born without legs than children who are born with legs, children who can't stand on their legs compared to children who can, et cetera, et cetera. Not because the trait is parentally selected as a fitness indicator, but simply because mothers are sensitive to naturally selected traits and the relative fitness of offspring on those attributes. One area which I was a little confused about, whether you were suggesting that selection has favored sensitivity to the current mating environment, such that there's either through imprinting at the genomic level or through some facultative process in the infant's mind, there is a change between populations based on mating systems. People have looked at a crude naturally selected trait, namely sexual dimorphism, as a result of histories of polyandry, of polygyny, for example, which should, by any standard model, select for greater sexual dimorphism. And there isn't any. There's no correlation at all. And the common explanation for that is that these marriage patterns are simply, they don't persist for long enough periods of time for there to be consistent directional selection. So one wouldn't expect that the same would be true in the case of autism. I have other thoughts, but I don't want to monopolize the floor. So.
Well, those are all very good. I appreciate all of them. I think, let me just tackle a broader issue here, which is that the strength of this hypothesis isn't so much any individual prediction, but the fact that a single sentence, autism is the low fitness extreme of a parentally selected fitness indicator, can produce so many predictions for which there's consistent data. There's no data that says, well, that's just obviously false. And that it makes predictions that are both potentially useful therapeutically and tested. The ones you brought up, I agree with you. There are other explanations. And let me just tackle now the important point you made about what distinguishes a parentally selected fitness indicator, or even a sexually selected fitness indicator, from a, I'll say, survival selected trait. Darwin called survival selection natural selection, and he distinguished it from sexual selection. But and you use natural selection, I think, for the same reason. And so the question comes down to this: why couldn't the brain systems in autism have evolved for survival, having nothing to do with trying to get additional resources from increasingly picky moms, but for some other purpose? And if so, what would the differences be in the predictions of the two models? And they are very similar, the two predictions. It's only on a few items that they become crucially different. One is the degree to which the trait would vary in the general population. And especially, what would be what's called the coefficient of additive genetic variance. This is additive genetic variance divided not by trait variance, but by trait mean. And it is thought that that measure is a better indicator of the number of genes involved in producing variation in the trait. Now, it's been shown that for survival selected traits, the coefficient of additive genetic variance is small. That is, the number of genes that end up affecting variation, causing variation in the size of a trait is very small if it's survival selected, because survival selection generally removes anything causing anything smaller or bigger than the trait. It also leads to genes which can produce the same size trait regardless of the genome they end up in. But directional selection, particularly sexual selection and also parental selection, produce a very different kind of trait whose coefficient is very high, indicating that much of the variation in the general population in the size of the trait is due to a large number of loci. So that is a key difference between the two kinds of traits, and we would want to look for that effect to tell the difference between the two. So for example, you said bipedalism. Well, bipedalism doesn't vary very much in the general population. There might be there are a few individuals who don't get it. The vast majority of individuals have it. What I'm saying is that this trait, social responsiveness, the things like the age at which a baby first smiles responsibly to its mom, are going to vary much more in the general population than is bipedalism. The variation you do see in bipedalism will have a very low coefficient of genetic variance. That is, it will be only a small number of loci that have anything to do with impairing bipedal locomotion. Whereas for social responsiveness, the coefficient will be gigantic, it will be huge. The other area where we're going to see differences is if there has been variation in the extent to which siblings have had to compete for resources, especially birth interval, and variation for long enough to affect the prevalence of various kinds of genes affecting fitness sensitivity, as you brought up, which is an interesting and important problem. But if such genes exist, then they have some very interesting predictions that are relatively easy to test. For example, a puzzling feature of autism is that the brains of babies who later develop autism grow very fast, so that by age 2 or 4, their brains are almost adult size, and then they stop growing. And nobody has a good explanation for that. This theory, if there are genes that affect fitness sensitivity, suggests that that rapid brain growth may be caused by a gene like I proposed, one that causes early and rapid brain growth. So according to our hypothesis, it would say this is happening because some individuals have a gene for very early brain growth. And when that gene is in a bad genome, the result is frequently autism. But when that gene is in a baby with very good genes overall, they develop charm early. Everybody sees them as a very charming baby. The mom thinks they're the greatest thing ever. Suckles frequently, continues nighttime feedings for a long time. The suckling sessions are longer. The total duration of suckling is longer. And that baby gets a longer birth and interval before the next sibling is born because of ovulation suppression. It's possible to test this because pediatric clinics routinely measure both social and language developmental milestones, like age at first smile, various other things. They also measure head circumference, which has been shown to be a good proxy for brain size. So if we're right, then we should see that this rapid brain growth is not restricted to babies with autism. It's evident if you compare babies with autism with the general population, But if you were to compare them with babies who had early attainment of social and language milestones, you would see that they also have rapid brain growth. And there's a more quantitative treatment of this, which I can show you, but that's the general idea. It also suggests the possibility of finding what these genes are. And you would do that by looking for what are called endophenotypes of autism. That is, not autism itself, but things that are thought to underlie it, such as rapid brain growth, or social responsiveness, the ability to track mom's eyes. You would evaluate all the potential endophenotypes, looking for those that vary the most in the general population. So you just track variance, you look for the ones with a huge variation, and then from those, you would select those that are even higher variance in the relatives. Because whenever you look at this group of, see, we're hunting for the gene that does this. And it's going to be more common among autistics and more common among those with very charming behaviors. And it will be more common among the relatives, as here it is in the autistics. It must be more common in the relatives. So relatives should look like this. This is how they should vary in social responsiveness. Right? If you looked at a bunch of families in which there have been autistic kids, my prediction would be that the social responsiveness of all the remaining relatives would look more like this line and less like the line for the general population. Well, once you have identified one of these endophenotypes that has these three characteristics to it, it's thought to underlie autism, it varies greatly in the general population, and it varies even more in the relatives. Now you can start hunting for the genes that underlie that trait, but in a very special way that isn't common to most genetic studies these days. Most of those assume that the gene we're looking to is simply more common in those with the disorder. But if that gene is more common in those with the disorder and those at the charming extreme, then you should put these two groups into one bin and these in the other, and look for a gene that's more common at these extremes than it is in the middle. That's the general strategy for hunting for genes that increase fitness sensitivity. So did I hit most of those?
Yes.
Okay.
Enough to move on.
All right.
What you just said was particularly interesting because I was at a Cure Autism Now event a number of years ago, and the very high-functioning parents of the autistic children that run that, the charity were offended or, not comfortable at all with the notion that they were harboring these defective genes as people were looking for defective causes. But that particular approach would be a good one to follow with that group. Is there anything that, are there any data showing that introvert interval actually varies following autistic?
Oh, no. There's no data. All there is that weaning is earlier in autism.
But not in
No, I don't have any data on interval. I thought you were asking about general populations where there's very nice variation in intervals, so it's a good topic to analyze. But I just wanted to respond to one thing and clarify the point. Those parents at the meeting would still be unhappy with me because I'm proposing a type of gene that's just bad, that's running in their family. It's these fitness-reducing mutations, right? The ones that cause low fitness. But as you say, they might be a little happier about a gene that causes very intelligent, charming, attractive, good language movements. Yes?
How would social constraints change the predictability of when these charm babies would appear? I'm thinking in the generation where breastfeeding was uncommon, or the generation when mothers are away from the home, so the children may be getting breast milk, but not from the breast, and things of that sort. Or would that affect the predictability when charm might appear?
It might very well in our hypothesis. That's why I said it's very hard to test some of these predictions in populations with doing bottle feeding, either with formula or breast milk, or even using pacifiers, because we don't know what the signal is that tells a baby your mom is done with you. She's going to move on to another sibling, right? The one that I'm saying could instigate, more desperate attempts to charm mom. And that's why testing some of these things would require natural fertility populations where those are not a factor. But I don't know what, it seems there are so many of them, it would be very difficult to control for.
Even though you presented data showing correlations among the different developmental disorders, I still would think that psychiatry would have a hard time with the lack of specificity in this theory, if you're predicting just general problems rather than specific autism.
I'm only predicting autism here.
Mm-hmm.
The question might arise, well, what other childhood disorders might be either part of this spectrum or part of an entirely different spectrum, something else children do to attract some other resource from parents? Is there another brain system that attracts teaching at age 5 and 6? Is it different from this one? Are there specific disorders that have something to do with that? I don't know, but you could apply a similar approach to it, where you say, well, when is it important for a baby to try to get that resource? That's when we'd expect to see problems with that particular trait. Is there a problem, say nervousness in a child, that varies greatly in the population and appears at a particular time when that particular resource is important to get? And you'd have to go through this same procedure again. I have not done that with childhood disorders. We attempted that with respect to whether any other adult disorders are related to sexual selection, and could not find any because even the most rudimentary critical data is missing from any psychiatric disorders. For schizophrenia, for example, we know that they have very poor reproductive success, and that is particularly true of men with schizophrenia. But until just a few years ago, we had no data at all in bipolar disorder, and almost none on any other disorder. So you can't even begin to ask whether they're sexually selected, because the first question is, does it impair getting a mate?
A little bit of trouble with the genetic argument part of it, and focusing specifically on autism. It seems that the argument you're making would apply in a general sense to any, let's say, sort of complex brain function that's dependent upon a number of different loci for the brain's development to be able to do that, so that mutations in any of those aspects that would then reduce the ability of that particular function. So it doesn't seem like it's specific to your charm autism, but in general, we're talking about a brain function that is fairly complex with respect to the underlying genetic aspects that are involved with the development of the brain. The same issue would arise, which is simply that through mutations, there'd be interference of that particular performance as well. And so obviously they would get a distribution of variation in the expression. For example, I'm going to talk about mental retardation the same way, saying that simply at one end of the extreme may simply be cases where one has had more mutations interfering with what is presumably more or less normal brain development. But that doesn't seem to require any of the issues about fitness or whatever. There's a fitness argument that it's said. That seems to be just a function of asking about something that's complex, and the kind of expression that one's going to get all the way from the very high end to the very low end, because there's so many ways that could be interfered with. The only argument about the fitness seems to come in would be something like, given that that's there already, is there something like parental reaction to that with respect to parental behavior? That is the parent picking up on that as a signal, but the signal itself seems to be just an aspect of the nature of a complex phenomenon that's going to be there regardless. And that doesn't have a selection issue or a fitness issue involved with it, except to the extent to which parents might be picking up on it as a signal.
Yeah, well, this is closely related to that first thing I said in response to Dan's question, which is that you can imagine that there would be traits which survival selection, natural selection, is incapable of making so simple that there are very few loci involved in variation in that trait any longer. And behaviors are one category of trait, mental phenomena, that fit well into that. once you've identified some behavior or mental process which varies greatly in the general population and has a high coefficient of genetic variance, suggesting that many loci are involved, then the next question to ask is, why is that? Is it just that survival selection just can't, this trait is very important for survival. There's no directional selection going on. But survival selection just can't make it simple enough to get reliably done in every genome. So it's very sensitive still to mutations all over the place. Is that the answer? Or did the trait specifically evolve to reveal mutations, like a peacock's tail? Right, so you can ask that question through a series of additional questions, because sexually and parentally selected traits and anything under directional selection has a different series of predictions to it than does a survival selected one. So for example, the one I brought up was, if there are any genes still affecting fitness sensitivity, that is a clue that there's something else going on, that evolution is specifically favoring genes that do just the opposite of what happens in survival selection. These are genes that cause sensitivity to deleterious mutations. So you can imagine getting a whole list of behaviors and other mental phenomena, looking to see which ones vary greatly and have a lot of genes underlying their variation, and then say which ones of these just are a problem, survival selection can't make them simpler, and which ones are specifically designed by some sort of directional selection process, like parental or sexual selection.
But if fitness itself is, let's say, due not simply to a specific, bipedism is fairly simple. One can say, well, you're talking about one thing, the ability to locomote yourself in a particular way, and you can't do the same thing in any other way. That isn't some aspect of the arms that allow you to do the same thing if in fact you didn't have legs, for example. But certainly when we're talking about behaviors, we have the ability, whatever's giving us the fitness, the overall capacity we have to exhibit in order to be able to be effectively able to, say, to get resources. There are multiple pathways by which we can do that. So, for example, let's say my being smart might be a good way to do it, but I might be not so smart, but can compensate for it by some other behavioral trait that altogether gives me overall the same fitness. So that there may not be any simple, narrow selection with respect to a particular behavioral trait that allow for sort of canalization of the loci that are involved with it, by virtue of the fact that it's is not it in isolation against a specific set of conditions, and we can look at it in isolation, but rather the fact that it and that sort of canalization may or may not work by virtue of the more canalized version might, under other circumstances, with other aspects of the behavior, in fact, not work as well. Like extraordinarily intelligent person might be pretty lousy in sort of ordinary living, as we well know, say, from some of the greatest mathematicians, often considered to be clinically insane. Whatever benefit intelligence gives you, you can't, at the same time, how it interfaces with other aspects of the general ability to survive. You can't just simply do it the same way as you can with something like fetalist. So it seems like it's a little hard to sort of narrow it down the same way and just sort of say, well, we can slough all these other cases by virtue of saying that if it were just simply survival selection that were taking place, it would all become canalized down to a few loci involved, and it's only in those cases where this mechanism is occurring that it wouldn't take place. And I don't see that as a very viable argument.
I'm not making that argument. You've made your argument now more complicated by saying it could be that many traits are in complementary or competitive arrangements with other traits, and yes, that would make things really complicated. I don't even want to get into that. All I want to say is, if autism is here on this distribution, there's a bunch of explanations and predictions. None of the explanations is refuted by any current data, and the predictions are interesting, and some of them could not be made by any existing theory that I know of. So if you tested all those things and it turned out to be true, then this is a pretty interesting idea. I'm not doubting that some of the potential complexities you bring up might affect some of those arguments, but one could approach those after taking a look and seeing how much mileage one can get from that single sentence.
I was just going to ask, are there implications for diagnosis of this? I mean, so, one thing that came to mind is are some people going to be better at diagnosing than others, or so would mothers or women be better
That's a
at
great-
diagnosis than men? Or, you know, or another sort of related question is, as we know, just sort of prevalence of autism has increased, and there's been debate about whether that's because the threshold required for diagnosis has changed over time. But I mean, is there a subjective? I mean, does your hypothesis suggest that there's going to be some subjectivity to it, that it's going to vary depending on who the observer is? I don't know. I mean,
Yeah, it's a great question. I'm embarrassed to say I hadn't thought of the diagnostic implications, being a
Okay.
psychiatrist. But you know, slide I didn't show you. With respect to like the eighth property, which is that preferences co-evolve with the indicator, we might expect that, or we would expect that women would be better at detecting poor social responsiveness in babies than would be men. Women of childbearing age, or maybe with their children of their own, should be even better at it. And women from populations with historically high sibling competition, perhaps because of high genetic polyandry, should be the best at it. And you would expect them, when faced with infants of various kinds, to have to have stronger feelings about which babies were really charming and which ones were not. So,
Right. I mean, I was thinking of the case that it's been suggested that there's that babies face different adaptive problem in convincing their mothers that they are their offspring than in convincing their fathers that they're their offspring, right? Because of the paternity uncertainty problem. And so there's been discussions about imprinted genes and whether you're going to have greater there's been a suggestion that there could be selection for imprinting to basically amplify genes that increase resemblance to the dad as opposed to the mom. I was thinking about asymmetries of that kind, because not only do you have selection on the mom, I mean, if your hypothesis is right, you have selection on mothers to be able to detect this more. The babies, whatever they're expressing in charm, is going to be selected to appeal more to mothers than fathers, perhaps, although I don't know if that's entailed. So,
yeah,
on
our
both sides of the equation, you could have.
You could. Our imprinting theory focuses just on this, that fathers should imprint the genes that underlie things that would increase the variation in fitness sensitivity, because they want all their offspring to be very charming and get a disproportionate share of mom's resources. Right? Moms would counter that imprinting by imprinting genes that tend to produce charming babies. They would make it more difficult for babies to be charming. And that allowed us to explain a puzzling finding that David Skuse reported a few years ago. He was looking at Turner females who, well, they're all female. They have a single X chromosome and no other sex chromosome. And he divided them, this was quite a few of them, 6 of them, I think, into 2 groups. Those whose X chromosome came from dad, and those whose X chromosome came from mom. And he measured social responsiveness by an extremely similar scale to the one I showed you in those Turner females. And in the Turner females whose X chromosome came from mom, they had poor social responsiveness in the direction of autism. Whereas those whose X chromosome came from dad, there was no effect. They were like the normals, suggesting that mom's imprint was on the X chromosome. And perhaps specifically so because the X chromosome is different. There are most of the X chromosome. There is no complementary chromosome with other genes on it. So there's no opportunity for dad to counteract that effect. And it may be that it's exactly what mom needs in order to get a good signal out of infants, which is impair their social responsiveness, knowing that dad will be ramping up their social responsiveness. And out of that interaction, you'll get variation in social responsiveness, which is just exactly what you need. We also made the point, though, that imprinting is not restricted to the sex chromosomes. In fact, this whole variation could be the result of the interaction between many different imprints on all of the chromosomes, competing imprints between dad and
All right, so I guess we're out of time on that one, so thank you very much.
My pleasure.